All right, hi Dylan. All right, we're gonna dive right into this. This is the 2025 Budget Reconciliation Bill, and it is July 24th at 7 p.m. We're gonna go over this bill. It's gonna be, it's not gonna be everything, but it's going to show a lot of the highlights of the bill. So, and if you miss it, this will be recorded, so it's no problem. All right. So again, our district is comprised of 765,000 people. That's 10 full counties: Adams, Franklin, Fulton, Bedford, Cambria, Blair, Huntingdon, Mifflin, Juniata, Perry, the western edge of Cumberland, and the northwestern corner of Somerset. Every U.S. House district is about 765,000 people. Last year, I ran for U.S. Congress on these platforms. I ran for our precious democracy, reproductive freedom, gun safety, public education, universal health care, and immigration reform. I am still running. I am refiled for the 2026 election, and I am running again against our U.S. Representative, John Joyce. Last year, I had the pleasure of going around the district, meeting lots of voters, learning about what's important to you, and just really enjoying knowing so many people and how much we care for one another. This year, I am still campaigning around the district. I've been to several protests and rallies, a couple town halls. I'm campaigning with other people who are running, and I just am feeling so honored and privileged to do so. I appreciate all of your support. And if you'd like to know more about my campaign, I invite you to bethfarnhamforcongress.com, and you can find out more about my positions. But that's that's my campaign, and you are here for this bill. Again, I want to remind you, we're talking about 10 full counties in our district, and now we're going to go over some of the statistics of our district as they relate to this bill. The first one is how many recipients of Medicaid there are. And so when it comes to Medicaid, let's see. We have several thousand recipients of Medicaid. It's over 161,000 people. I don't have the precise number because we don't know how many people in Cumberland County and part of Somerset. We only have numbers for whole counties. So we know that there are some people out of the 45,000 recipients, some of those are in our 13th congressional district, and out of the 15,000 recipients in Somerset County, some of those are in our 13th congressional district. I put pluses and minuses beside each number so that you could see the change over time since I had last looked at these numbers in March. There are negative signs for those where there were fewer recipients since March, and pluses where we've increased the number of recipients since March. For Medicare, same deal. It's county by county, and we have over 194,000 recipients of Medicare. Remember, both for Medicaid and Medicare, the benefits do not go directly to the people. They go to the providers, the hospitals, the ambulances, the doctors, the services that they're receiving. It does not go directly to the person. And then in our 13th congressional district, we have several recipients of SNAP benefits. SNAP is Supplemental Nutrition Assistance Program. And so we have several thousand people, over 107,000 people, about 110,000 really, in each county and the parts of the counties. Some of those numbers have increased or decreased over time. Please keep in mind that that SNAP is for the children under 18 and adults over 55. And there are work conditions. There are conditions that must be met for work, though it used to be that the condition was only till 55. That is changing for this bill. The work conditions increased to the age of 64. We're going to get to some of those other conditions. In the 13th Congressional District, there are another way of understanding this number. There are over 47,296 households that receive SNAP benefits. And lastly, another type of food assistance is through the Women, Infants, and Children program. And we have several thousand people, almost 13,000 people who receive WIC food assistance. Let's see. So not as many as the others, but still people who qualify for these benefits. All right, but you're here for the One Big Beautiful Bill Act. So now we're going to dive into certain elements of that. Overall, you should keep in mind that people are going to lose benefits, and the major way they're going to lose benefits is through attrition. Attrition is the action or process of gradually reducing the strength or effectiveness of someone or something through sustained attack or pressure. So most of these changes in the bill will cause attrition and therefore loss of benefits for individuals over the next decade. Much of this is applicable for the next decade. All right, and some of the elements that we're going to discuss today are the healthcare benefit reductions, the nutrition benefit reductions, the tax cuts and increases, the defense budget increase, and the increased deficits. First, we're going to talk about the healthcare benefit reductions, and that means the Medicaid impacts. Now, I'm someone who likes to cite our sources, so I've put a link here at the bottom. This is from the Kaiser Family Foundation. I found them very helpful in terms of laying out the different elements that were affected by this bill, and they've categorized them. So if you go to this particular link, you will see these categories: Medicaid, the Affordable Care Act, Medicare, and health savings accounts. So they've laid out the major pillars on how healthcare benefits will be impacted by this bill. And so we're going to focus on Medicaid right now. Now, the Kaiser Family Foundation did a nice job of laying out all the bullet points of what would be impacted. So expansion, coverage, and financing, cost sharing, but we're not going to go over every single one of these. We'd be here for hours. But I wanted to give you the scope of what this would look like. And here are more: home equity limits, gender affirming care. So you can, again, you can go right to this link, and I will be leaving the deck for you in the comments. You can go right to this link to see these for yourself if there's a particular subject that interests you. But here are the ones we're going to talk about. The first thing that I think is very important for you to understand is the work requirements. OBA requires states to condition Medicaid eligibility for individuals ages 19 to 64 applying for coverage or enrolled through the ACA expansion group or a waiver on working or participating in qualifying activities for at least 80 hours per month. This is new. There are exemptions. Caregivers of dependents who are 13 and younger, or of disabled individuals, Indians, and that's their term, veterans with disabilities, and those who are quote unquote medically frail. That is, again, the term they use in the bill. People who are incarcerated, people who are pregnant, suffer a substance disorder, are in rehabilitation, or suffer a developmental disability. So there are exemptions for this, but they are requiring that people work 80 hours a month. what we need to understand is the number of hours of work is not necessarily in the control of the people who are seeking the work. It is really in the control of the employers. So already the people who might be willing to work and able to work must then be employed by someone willing to give them 80 hours at least per month. So that's the first condition that they're going to try to meet, but may struggle to do because it's not within their control. Another impact is that states need to verify the enrollee address and other information. There's a requirement to obtain enrollee address information and conduct quarterly enrollee reviews against the Death Master File, effective January 1st, 2027, and submit enrollee Social Security numbers to the new CMS system to prevent Medicaid enrollment in multiple states. Now, all that just means is they really want the states to make sure that people are not duplicating benefits from one state to another. But as you will see, that has not been the kind of fraud perpetrated against Medicaid. We're going to get to that. But this is why this is coming up. The claim is that the fraud, waste, and abuse is happening because enrollees or beneficiaries have been duplicating themselves in other states. They've got multiple addresses, and so they show multiple times and therefore can benefit from the system and get Medicaid to pay for a bunch of services or perhaps medications because they're listed in multiple states. But we're going to cover that. There is also a requirement to conduct eligibility redeterminations every 6 months for the expansion population. And again, I cite my source. Now, you might ask, well, why is the bill making these requirements? How effective is it that we would lose people in the process, whether they didn't get enough hours or they failed to review in time, they didn't check in as they were supposed to, the states didn't verify addresses. When the person gets on the computer, if they're doing it faithfully, are they really going to be attrited? And the answer is yes, because this is a very effective way of removing people from the roster. And we see that from the example provided in the state of Arkansas. In 2023, the Arkansas Department of Health and Human Services disenrolled more than 112,000 Medicaid beneficiaries in 3 months out of the 1 million Arkansans who received Medicaid benefits in 2023. Quote, the disenrolled clients, that's 40,497 in April, 34,724 in May, and 37,510 in June, either failed to return a Medicaid renewal form, failed to submit additional required information, or were unable to be reached by the department, according to the DHS report. That's a lot of people in a very short time to have lost their Medicaid benefits. As it turns out, there was a lawsuit, and so then those people were reestablished with Medicaid. However, this practice of reviewing and ensuring and enrolling and making sure that people meet all the work requirements, etc., this process eliminated over 100,000 people in 3 months, and it is now the federal law. Additionally, there will be Medicaid impacts to immigrant eligibility. Now, there always were immigrants who were qualified for Medicaid. They were lawful permanent residents and certain Cuban immigrants and certain Haitian immigrants and citizens of the freely associated states, the COFA migrants from Micronesia, the Republic of the Marshall Islands, and Palau, lawfully residing in the U.S. lawfully residing children and pregnant adults in states that cover them under the Immigrant Children's Health Improvement Act, ICHIA. And those immigrants continue to be qualified for Medicaid. However, there's another group of immigrants who were qualified who, under this bill, will no longer be qualified for Medicaid. They are refugees, individuals granted parole for at least 1 year, individuals granted asylum or related relief, certain abused spouses and children, certain victims of trafficking. Again, that group will be unqualified under the new bill. Okay, what about the undocumented immigrants? That has been a big point of discussion. There are a lot of people who didn't want Medicaid to go to undocumented immigrants. Now, remember, Medicaid is one of those benefits that never goes directly to the people who need it. Again, the Medicaid benefits go to the providers. However, there were Medicaid benefits, and there still are, that go to undocumented immigrants under one particular circumstance. Normally, undocumented immigrants are not eligible for federally funded Medicaid coverage. However, under federal law, hospitals are required to provide emergency care, which includes that to immigrants, no matter their status. So you've got a federal law that requires hospitals to provide emergency care. They have to provide this. Emergency Medicaid exists to reimburse hospitals for those immigrants who would qualify for Medicaid except for their immigration status. Now, OBA will limit the federal matching payments for the emergency Medicaid for those individuals who would otherwise be eligible for expansion coverage to the state's federal medical assistance percentage, FMAP, except for their immigration status. So before, the federal government would look at those hospitals and say, okay, you did provide emergency care to these undocumented immigrants, and if it weren't for their undocumented status, they would have qualified anyway, so we're going to reimburse you. Now the limits for that reimbursement have been lowered. So the hospitals are still required by federal law to provide the emergency care, but now they're going to get less money back from the federal government for providing emergency care as required by law to those undocumented immigrants. Now, there's an upshot to this that's important to also cover. When there will be so many people over the course of a decade losing their Medicaid benefits, they will no longer be able to have Medicaid benefits. A lot of rural hospitals are going to suffer. And so in this bill, they've decided to offset that anticipated suffering with a $50 billion rural health transformation program to be used between fiscal years 2026 and 2030 for payments to rural healthcare providers, expanding health workforces and other system transformation purposes. In other words, they recognize that, yes, there are going to be a lot of people losing their benefits, and so these hospitals could very easily close. And so their idea is to provide a $50 billion rural health transformation program. However, we don't know all the details about how that will be rolled out. Okay, now we get into DISH payments. So you have to understand, when the Affordable Care Act was first rolled out, the idea was it was as close to universal health care as possible. And so there were hospitals that needed, they served a disproportionate percentage of low-income, uninsured, and Medicaid patients. And so these hospitals would, pay taxes, and then that pool would then be awarded to the hospitals that had the greatest percentages of these uninsured, low income, and Medicaid patients. They had a disproportionate share of these lower income, uninsured, and Medicaid patients. And so this pooling of the taxes would kind of offset that tremendous burden that it was to the hospitals to take in all these people whose reimbursements were very low. However, it was understood with the Affordable Care Act, there'd be so many more people having insurance and so many fewer people uninsured that these payments could be reduced over time. The hospitals wouldn't need them as much because people walking through their doors would be insured. However, we know that is not the case. As different legs of the Affordable Care Act have been kicked out from under it, there have continued to be uninsured people. And so these hospitals still rely on these reimbursements, these disproportionate share hospital payments. Unfortunately, Congress signing this bill decided that the reductions were still going to take place starting this September. Again, many hospitals that serve a disproportionate percentage of low-income, uninsured, and Medicaid patients contribute taxes to a shared pool that comes back to them based on the higher proportion of low-income, uninsured, and Medicaid patients they serve. These payments have normally been used to cover unpaid costs of care for people who are uninsured and to supplement Medicaid payment rates that often do not fully cover provider costs. DSH payments totaled over $17 billion in federal fiscal year 2023. Federal DSH spending is capped for each state and facility, but within those limits, states have considerable discretion in determining the amount of DSH payments to each DSH hospital. Again, there's going to be less money coming from the federal government, as if the Affordable Care Act had been so very successful that there was hardly anyone uninsured. But unfortunately, now we have the worst case of both worlds. And again, we looked, I thank the office of the governor of Josh Shapiro. Their office was able to drill down to the number of recipients per county who may lose Medicaid. And so we see it at around 10%. So in Adams County, about 1,676 people will lose their Medicaid. So you can see, and of course, we don't know our particular portions of Cumberland beneficiaries and Somerset beneficiaries. And for the entire congressional district, again, the office of the Governor Shapiro has tallied the numbers, and they said, PA 13, represented again by John Joyce, over 17,273 people will lose Medicaid coverage in the next decade. All right, and the Kaiser Family Foundation listed a lot of subjects, a lot of impacts through which people would lose their Medicare. So we're going to go over a few of these. But again, I encourage you to go to that Kaiser Family Foundation website and look it up for yourself if it interests you. Okay. So we do have Medicare for citizens, of course, and green card holders, and COFA, those migrants from the Marshall Islands, Micronesia, and Palau, and certain Haitian and Cuban immigrants. Unfortunately, Medicare Part A will no longer be in effect for lawfully present immigrants, even if they or their spouses have worked in a job for at least 40 quarters where they paid Medicare payroll taxes and are at least 65 years old. People under the age of 65 with a qualifying disability, end-stage renal disease, and amyotrophic lateral sclerosis are also, they were generally eligible, but that will no longer be in effect. It will no longer be in effect for legal immigrants younger than 65 who have lived here at least 5 years. Medicare will no longer be in effect for asylum seekers. This is Part A. Medicare Part A will no longer be in effect for refugees, and it will not be in effect for anyone in the above mentioned group after 18 months. So they're going to be taken off after 18 months from July 4th of this year. The cuts to Medicaid will also affect Planned Parenthood. Now, that's always been a controversial organization for people who do not support reproductive care, such as access to abortion. However, keep in mind that federal funds do not pay for abortions. Medicaid funds have not paid for abortions since the Hyde Amendment was enacted. And so when people need abortions, they may be paid for by donations or privately or by their own personal insurance, but they have not been paid for by Medicaid. However, this bill says any organization that in 2023 received over $800,000 in payments from Medicaid, not for abortions, because of course that wasn't in effect, but for any other service they offered, such as mammograms or STD testing, any other type of service they offered, if they received over $800,000 in payments in that fiscal year 2023, then that organization will not be able to accept Medicaid for 1 year. And so who would be like that? Well, Johnstown in our 13th congressional district has a Planned Parenthood, and it is not one where abortions are even performed. It is actually a Planned Parenthood where there's pregnancy testing, postpartum care, HIV testing, vaccines, health and wellness, gender affirming care, birth control, STD testing, mental health, and emergency contraception. That is one of the Planned Parenthoods that doesn't offer abortions, but that very well has accepted Medicaid payments. And so very likely that Planned Parenthood will not be in operation, will not be able to accept Medicaid payments for 1 year. And if they can't accept Medicaid payments for 1 year, it is quite possible they will shut down and those services will not be available in that way. Okay, there are also Affordable Care Act impacts. The Affordable Care Act is generally for able-bodied working adults who can't normally acquire health insurance through their place of work. Often laborers like janitors, nursing assistants, construction workers, servers. And if they're making minimum wage, they're making $7.25 an hour. So we're talking about working adults, but who just don't make a lot of money, maybe don't work a lot of hours. If they do work full time, they might be earning about $15,000 a year. The Affordable Care Act looks to cover them, give them access to a health insurance. And there were 44 million people enrolled in it, actually, in 2024, per the Kaiser Family Foundation's website. And normally the coverage is auto-renewed, and there is an open enrollment that ended January 15th of every year. However, with the new bill, there are going to be a lot of changes. And the first one, as you can see, is the open enrollment period. And so they are changing it. It will no longer end January 15th. It will end a month earlier. So open enrollment will only be available from November 1st to December 15th. Now, in Pennsylvania, the Affordable Care Act is known as Penny, and we have about 500,000 Pennsylvanians enrolled. Unfortunately, because this bill is ending marketplace tax credits, the premiums for these workers may increase up to 82%. Now, more recently, I saw it as 75%. But people who are enrolled in ACA may see significant increases to their premiums they have to pay to keep this insurance. It will no longer be as affordable as it once was, which is extremely concerning. And if you're only making $7.25 an hour, you're going to be making some very tough decisions about whether you continue your more expensive health care or you use that money to pay for food and other necessities. It's also ending the automatic re-enrollments. So that's, again, attrition coming into play. And then, therefore, there would be fewer people enrolled in ACA. And this is the way that the OBA is claiming that it's going to save money. By having fewer enrollees through attrition, they will then not be expending the money. But that also means more people who are uninsured. Up to 200,000 penny enrollees could lose their health care through the Affordable Care Act due to the passage of OBA. That is extraordinary and terrible. This is over a decade, but that would at least be, 20,000 enrollees per year. It's extremely concerning. It's very terrible. The Congressional Budget Office estimates that roughly $1 trillion in Medicaid cuts over the next decade will result in about 12 million people losing coverage. And the census says people in vulnerable populations, as defined by socioeconomic characteristics, made more preventable visits to the emergency rooms than others from 2013 to 2017, according to the U.S. Census Bureau working paper. The study analyzed census data linked with emergency visit records in the state of Utah. It found that factors, including lower income, educational attainment, unemployment, lack of health insurance, lack of access to a vehicle or internet service, were associated with a greater number of preventable visits. So what's this about? The point is, and I've got a picture of Gettysburg Hospital's emergency department here. The point is, even when people do not have health insurance, they may seek health care. And by law, they can receive it from the emergency department of a hospital. Now, this particular study says, people with a lack of health insurance still went to the emergency department. And what did they go for? They went for preventable care. So they were still seeking care at that time. But, if they had just had access to health insurance, then they might have prevented whatever situations arose that caused them to go to the emergency department. And very often when people don't take advantage of health insurance and use and have access to preventable care, they may suffer, their likelihood to suffer a crisis, a health crisis, increases. If you can't take that blood pressure medication, you may suffer a heart attack or a stroke. So there are some very concerning elements around this. Yes, people, we may save some money in certain ways, but people are still going to seek care. And, I'm not an accountant, but I can look at trends and understand them. Here is an understanding of basically the budget for Gettysburg Hospital, for example. And you can see in where I've, drawn some crude red arrows here. What we understand from this bill is that the Medicaid reimbursement is going to go down, whether more uninsured people walk through the doors, or even if so, the dish payments go down. And yet, as they're walking through the doors, they're going to cost more. They're going to have more health crises. They're going to cost the hospitals more. That is the trend. And that is not a positive trend for our local hospitals. And you can see that even Little Gettysburg Hospital was already dealing with revenue in the billions. That's one hospital in our congressional district. So that $50 billion of offset is clear that it's not going to go very far. All right. All right. So what happens when hospitals get these very sick people coming through the door who don't have insurance and their costs increase? Naturally, they're going to turn those costs over to the people who do pay insurance. That's the rest of us. Those of us who pay insurance through our work are more likely to see our insurance costs rise because those hospitals, to stay afloat, have to get the money from somewhere. And so they're naturally going to turn to whoever is paying. So we can be sure through this OBA, this bill, our costs are going to increase. We're going to see increased premiums to our health insurance. So why was it so important to enact this bill? Well, if you look at the verbiage of the bill itself, it's peppered with all kinds of language: fraud, duplicate, deceased, erroneous, excess, eligibility, alien, wasteful, prohibited, abusive, personal accountability, certain individuals. You can really hear through this language, this bill is targeted at people who seem to be taking advantage of the system, beneficiaries. And who's losing the most? People who have Medicaid. But again, I remind you, those people who have Medicaid and Medicare aren't receiving the money directly themselves. The money goes to the providers, like the hospitals, the doctors, etc. So who's committing fraud? Well, there are reports about this. There's the annual report from the Departments of Health and Human Services and Justice from December 2024. I've linked it here for your perusal. There's the report for Medicaid Fraud Control Units, fiscal year 2023 annual report, and I've linked it here for you as well to look at. At Georgetown University, they studied these reports. They wanted to know who is perpetrating this fraud. And this is what they found. Fraud against Medicaid is mostly committed by providers. To crack down on fraud, Congress and the administration should follow the money. That was their recommendation. The December 2024 report lists examples of the different kinds of fraud against Medicaid and Medicare that the agencies have identified and prosecuted. Among those convicted are, and now they're going to list all these kinds of providers: ambulance service providers, durable medical equipment suppliers, diagnostic labs, nursing homes, pain clinics, pharmacies, physical therapists, physicians, and substance use treatment providers. No beneficiaries are in the listing. So now we've got it in black and white. It's not individuals perpetrating this fraud, it's the providers. And yet when we look at that bill, it's going after individuals, and it is individuals who are going to lose their health care. This is the injustice that so many of us are seeing. And I hate to Columbo you, but just one more thing. Sequestration. Even those $1 trillion in healthcare cuts don't pay for the tax cuts fully, so the deficit would increase substantially. Once the deficit increases, that would trigger automatic reductions, further reductions in Medicare, totaling $500 billion. That's from Mr. Larry Levitt, Executive Vice President at the Kaiser Family Foundation, and he was able to share this in a podcast. So I've linked that to On Point, the podcast. I've linked it here so you can listen to it as well. It's very sobering. All right. Moving on. We're going to go to nutrition benefits. All right. The Supplemental Nutrition Assistance Program, also known as SNAP. We have 1.9 Pennsylvanians who rely on SNAP, and they are mostly children, but also seniors over 55. The SNAP benefits average about $211.93 per month per person. So I offer that to you so you can get an idea, because if you think about your grocery bills, I mean, does that scale for you? If you're a family of 4, are you spending about $800 in groceries per month? Or $850? All right. Now, the way the OBA bill is created, they have decided that they are going, the federal government, which had been paying half of the administration costs and all of the benefit costs, they are going to pay less in administrative cost and less in benefit cost. This is a lot of words and numbers, so I made a pie chart for you. This is SNAP under normal circumstances for the state of Pennsylvania. We're talking about $4,300,000,000 in SNAP benefits. These go directly to the people. Again, it's about $211.93 per person per month in terms of benefits. And because there are so many people, we're talking 1.9 million Pennsylvanians, it costs money to administer this. It costs about $500 million to administer this. And in the past, Pennsylvania has paid $250 million of this administrative cost, and the federal government has paid also $250 million of this administrative cost. But they have decided to cut their contribution for administrative costs in half. So that means they're going to pay $125 million less. That means that the state of Pennsylvania is going to have to pay $125 million more. But there's more. You see the big orange, the big dark orange? The federal government heretofore had paid $3,800,000,000 in terms of the costs, those benefits that the recipients directly received. That was all coming from the federal government. But now they're going to pay less. I forgot to put in my commas. So it's going to be $3,150,000,000. So what's happening here? Well, if the federal government pays less and we still expect that 1.9 million Pennsylvanians who qualify, remember, they're mostly children and seniors over the age of 55, if we want to keep them on their SNAP benefits, then the state of Pennsylvania has to come up with up to $650 million. Last year, the federal government was paying $650 million, and when this goes into effect, the federal government will not pay up to $650 million, and they will not pay the $125 million that they were paying in administrative costs beyond the $125 million. So again, they're going to reduce their administrative cost so that they're only paying $125 million. That means the state of Pennsylvania also has to come up with $125 million in administrative costs, again, to keep the 1.9 million Pennsylvanians on the SNAP benefits they have. And who are we talking about? Children and seniors. My question to you is, do you think the state of Pennsylvania will come up with this extra almost $800 million? Or will people lose SNAP? How much do we need SNAP in our 13th congressional district? Well, just to give you an idea, over 46% of our public school students qualify for the National School Lunch Program. So we've got a lot of students who meet the qualifications for the free and reduced lunch program. And one of the qualifiers is SNAP. Does your family receive SNAP benefits? If so, they're more likely to be on the free and reduced lunch program. So if they're losing SNAP, they may lose this too. It means that families will have to do more with less. And how badly off are people in this district? Well, unfortunately, the Greater Johnstown School District students, 98% of them qualify for the National School Lunch Program. According to the Office of Governor Shapiro, it is estimated that 6,626 people will lose their SNAP benefits in the next 10 years. All right. Now, why, if so many people are going to lose healthcare benefits and food benefits, well, who's going to do well with this? Well, we're going to look at the tax cuts and increases. So for people like my family, who've been able to take advantage of the child tax credit, that is going to increase from $2,000 per child to $2,200 per child. That's an increase of $200 per child. However, there are a few conditions. At least one parent must have a Social Security number, even if the child has one. And the refundable portion of the tax credit is capped, limiting the ability of the country's lowest income parents to access the credit. So if you are very, very poor, you probably can't take much advantage of this credit anyway. All right. There will be tax cuts for overtime and tips. These are above the line deductions. The tips deduction will be capped at $25,000 per individual and expires after 3 years. Most people that I know don't make $25,000 in tips, but there's a cap to that. The deduction, remember, only applies to the federal taxes. People who receive tips will still need to pay their state and local taxes. There may be a savings of up to $1,800 per year. The top 20% of tipped workers would receive an average tax cut of $5,768, while the bottom 20% would only receive a $74 tax cut on average, according to the Economic Policy Institute. There is overtime, a benefit for those who work overtime. There is a deduction, but it is capped at $12,000 per individual. Here's another condition. Overtime deduction only applies to amount beyond standard hourly wage. So let's say you make $20 an hour as your standard hourly wage. And when you work overtime, you make $30 an hour. You make 1.5 times your hourly wage for your overtime. Well, I'm sorry to tell you, the deduction will only apply to the $10 beyond your hourly wage during those overtime hours. So you can take advantage of the overtime deduction, but again, only on the $10 per hour of the overtime that you worked. You will not be able to take it on the $20 of the overtime you worked. The overtime deduction only applies to federal income taxes. You will still need to pay your state and local taxes for overtime that you've worked. For Social Security, it's a little bit better of a picture. This is for people 65 and older. There is an additional deduction of up to $6,000. This is only good for the next 3 years. So by the time of the next presidential election, when they're sworn in, this will no longer be in effect. For individual filers, it's for those who receive $75,000 or less, and only 50% of the Social Security income is taxed when combined income is between $25,000 and $34,000. And so I say only 85% of your Social Security income is taxed when combined income is greater than $34,000. So let's say you receive $34,000 and $8,000 of that is your Social Security income. Only $4,000 would be taxed. Okay. The new tax package includes an additional deduction. There are some other parameters around this. If you're married, you may receive the full deduction. For incomes above $150,000, if you're married, the deduction gradually phases out. And in order to get a better understanding, I actually found a really great interactive page from the Washington Post. So you'll be able to plug in your own numbers to determine what you might receive. And I'm going to go to that right now. Let's see here. Okay. Okay. So this is an interactive. And I think the one I care about a lot is the unmarried person, 2 kids at $20K. Meet Tara. She makes $20,000 per year and has 2 kids. She files as single and her whole family uses SNAP and Medicaid benefits. She would be about $122 better off because of provisions in the bill. It's interesting, when the Washington Post first put this interactive calculator out, they said that she was receiving about $1,600 in benefits and that she would lose about $800 worth of benefits. So she'd be $800 worse off. Now they've recalculated it since the Senate version passed, and now they say that she's going to be about $122 better off. But I'm a little bit worried about this $436. It's hard to know how comprehensive that is. I remember the Medicaid benefits don't go to her directly. So it is possible that this number will not be correct, but we're dealing with averages here. I don't like that she loses $436. Somehow she's $122 better off. But I think this may not be quite accurate. I think we'll be hearing some stories from people. A lot of people have, and I'll be keen to hear those stories. Again, we know that attrition's going to occur. So I think this is based on the idea that she keeps up with all these enrollment requirements. So I think we'll hear some different stories than the $122. But that's better than how it looked through the House version of the bill. Married, 2 kids. This person doesn't get any government benefits. And so if you consider that the 2 children get, there's a tax savings through the child care credit, $200 per child more, they're going to do better. And therefore they may see a savings of over $2,000. That's also assuming that he has tipped income. I think that was part of his profile. And they had the senior at $90,000, but they also said that the real annual income was $130,000. So they make $90,000 per year plus $40,000 from Social Security. And if this is anyone you know, then they're going to do very, very well with over $6,000 in savings. But you can use this yourself. You can plug in your income, state, filing status, and number of dependents. So I recommend that you use it just to get an idea of what changes may impact you. Okay, and we'll go back to this one. Okay, but unfortunately, starting in 2029, those making $30,000 a year or less would see a tax increase because I said, they go away. And those at the top 0.1% would get a $309,000 tax cut on average. Why is that? Because the 2017 tax cuts are being extended permanently. So the ultra wealthy are going to see their tax cuts after 2028, whereas most other people are going to see them fall away at that time. There will also be defense budget increases, including $29 billion for shipbuilding. And I just want to get to another piece of information. Okay. All right. And we will have, there will be $25 billion for the proposed Golden Dome Missile Shield Project, $45 billion for immigrant detention to be spent over 4 years, $12 billion to the Department of Homeland Security for border security and immigration, $12 billion to Customs and Border Protection for hiring, vehicles, and technology, $6.2 billion for more technology, $45 billion to complete Trump's border wall, $3.3 billion to support immigration courts, drug trafficking, and other policing programs. But it does cap the number of immigration judges at 800, despite a U.S. immigration court backlog of more than 3 million cases. Side note, the Pentagon has failed its last 7 audits. And so you can read that. That's so total $170 billion to increase our defense budget in these ways. Despite the $1 trillion lost through Medicaid, there will be an increased deficit. The new additional senior deduction and other changes in Trump's big, beautiful bill may reduce taxation of Social Security benefits by approximately $30 billion a year, estimates the Committee for a Responsible Federal Budget, and thereby accelerate the projected insolvency date for the Social Security Trust Fund devoted to retirement benefits in late 2032, up from the currently projected date of 2033. So if you were planning to rely on Social Security from 2032 on, you might not receive the benefits that you're used to receiving, and that is directly related to this bill that just passed on July 4th. It does increase the insolvency, etc. Because the 2017 tax cuts have been extended, the Congressional Budget Office does project that this bill, OBA, will increase the national deficit by $3.3 trillion. And again, when we increase the deficit substantially in a certain amount of time, that triggers more cuts to mandated programs like Medicare. So our current deficit is $1.83 trillion, and the projected deficit will be $5.13 trillion. Our current national debt is $35.46 trillion, and our projected national debt will then be $39.46 trillion. This may cause other countries concern. They may want to collect on some debt that we have. It may cause increased costs to our living standards. There will be extra impacts, such as loss of money to FEMA, $646 million, and $545 to the FBI. Let's see here. I'm going to get those notes that I had. Yes. $646 million slashed from the Federal Emergency Management Agency for Violence and Terrorism Prevention, $545 million slashed from the Federal Bureau of Investigation, cutting its workforce by more than 2,000 personnel and reducing its capacity to keep criminals off the street, $491 million slashed from the Cybersecurity and Infrastructure Security Agency, CISA, making our cyber and physical infrastructure more vulnerable to attack, $468 million slashed from the Bureau of Alcohol, Tobacco, and Firearms, greatly reducing its ability to crack down on firearm trafficking and reduce gun violence, $112 million slashed from the Drug Enforcement Administration, DEA, greatly reducing its capacity to help state and local law enforcement, and weakening efforts to fight international drug smuggling impacting the United States, $107 million slashed from the Bureau of Indian Affairs, Public Safety and Justice, exacerbating current understaffing and making tribal communities less safe. There are a few other things. Let's see. Lastly, a few other estimated impacts. This bill threatens an estimated 1.75 million construction jobs and over 3 billion work hours, which translates to $140 billion lost. Let's see. Sorry, just trying. In annual wages and benefits, $1,000. Now, here's something that's positive. $1,000 in the custodial bank accounts for newborns for the next 3 years. There will be cuts to wildfire prevention programs like raking the forest management services, and eliminating personnel hired to fight wildfires. There will be penalties to families who own a hybrid or electric vehicle because it will increase the cost of taking personal responsibility even more. Those tax credits won't be as available. Betrays student loan borrowers by ending student loan deferment for borrowers who experience job loss or other financial hardships, and forbids any future student loan forgiveness programs. As a reminder, Pennsylvania's 13th Congressional District's U.S. Representative, multimillionaire physician John Joyce, did vote for H.R. 1, the One Big Beautiful Bill Act, twice. And so that basically wraps up my presentation here. And, if you enjoyed it, thank you for coming. And please donate if you can to my campaign. But I am able to take typed questions. If you have any questions, you're welcome to ask. And my campaign manager, Jack Stansbury, will be fielding those questions and sending them up to me. Any questions? Thank you, Christina. Appreciate it. Anyone who would like to volunteer with my campaign, on my website, I actually have a place where you can click on it and provide the information to a form. And then Jack will actually get in touch with you about how you can help the campaign. So I do appreciate you taking the time to come to this. Just any more questions? Are you all going to try to use the interactive from the Washington Post article? That's my question to you. Let's see. Thanks, Christina. Okay, well, I think with that, I guess we're good to wrap up. So if you have any questions, just reach out to me through the website and or just Gmail, Beth Farnham for Congress at gmail.com. Thank you all for coming. I really, really appreciate it. I hope you got something out of this, and I'll see you soon. Take care.